to all of you reaching the hand out and really looking forward to having some dialogue with you and also give you guidance on what we're thinking and how we're actually carrying all of this forth. We'll go ahead and record this meeting and this webinar, and feel free to refer back to it later if you have any questions, and also know that this is ongoing conversation. You can ask us questions as we move throughout, and of course, ask us questions after and well after this webinar. So very, very glad that you're all with us. My name is Carolyn Phillips, and I'm thrilled to have Liz Prasad with me today as the co-presenter, and she actually is our lead on dissemination. She has done such an awesome job. So I am very honored to serve as the Director of Tools for Life and Director of Services and Education here at the Center for Innovation, Center for, CIDI. And we're within the College of Design here at Georgia Tech. And it's really awesome work that we get to do with folks all across the country, actually all across the world. And it's focused on inclusive design and innovation. And that's the great work that we get to do. So Liz, I'm going to turn it over to you to introduce yourself.
Thank you so much, Carolyn. Hi, everyone. I really appreciate your time for being on today's webinar. We are really excited about this one. As Carolyn said, my name is Liz Prasad. I am one of the co-principal investigators for this particular project, but my everyday role is Program and Outreach Manager for Tools for Life, which is a program that I absolutely love. It is the assistive technology program here in Georgia. And as you know, we are all under the Center for Inclusive Design and Innovation here at Georgia Tech. So again, just very excited to be with everyone today. And thanks for your time and all of your energy just for joining us so you can learn more about this important project. And we absolutely need y'all as we're spreading these messages, accessible materials. We have a couple of tips for today's session, just so everyone is comfortable and we can kind of get in the groove of everything. Wanted to let you know, just a reminder that today's webinar is being recorded. The webinar recording, transcript, and accessible PowerPoint will be made available to anyone that needs it to view the recording in the archives, and also just to share it with other potential dissemination partners. Captions are available within Zoom. You can do that by selecting Show Subtitles, or you can click on this link for full view of the captions, and we'll actually get one of our co-hosts to put this link in the chat. So if anybody needs it specifically, you can grab that. Wanted to let folks know that if you're not actively speaking, please mute your microphone. Carolyn and I have a lot of wonderful information for you, and we're going to be moving through this pretty quickly because we want to allow for plenty of time at the end for Q&A. And we'll also be working on microphones behind the scenes as well too. Please feel free to utilize the chat window to ask questions or post comments throughout today's presentation, but also know that there will be an opportunity for you to unmute your microphone. You can also use the raise your hand feature during our Q&A portion at the end of today's presentation. So again, just excited that y'all are on with us. And just looking forward to sharing more information. So as I mentioned, this webinar is being recorded. It will be archived, posted online, but also just sent out to folks that need it. Also, we'll have a link posted at the end just for information from y'all. We want to know how we're doing, but also just more information about the project and ways that you can further help us with dissemination. And we'll be sharing more information throughout our time today as well too.
Excellent. Thank you so much, Liz. Also wanted to let you know, we believe in practicing what we teach about accessibility. And so you'll see that Chris has joined us. She is our awesome, yes, ASL interpreter. And so thank you so much, Chris, for joining us. Very thankful for our collaboration with DeafLink, longstanding and very, very wealthy and rich collaboration that continues to pay off. And also you have captioning. So you can either turn it on within this platform of Zoom, just like Liz was saying, or you can also, as Liz was saying, connect it through the link that's in the chat. Making sure that people have access. That's what the whole thing is about here, our whole conversation. So what we're hoping when it comes to our session objectives, as we wrap this up, we want to make sure that you're going to be able to be very familiar with the objectives of this specific project and the ways in which it's designed to provide more accessible messaging, just like we are demonstrating here about COVID-19 to individuals with disabilities specifically. That's the primary focus here. Understand how the messaging is being made more accessible for specific disability audiences. There is a lot of thought and a lot of energy, a lot of folks around the country who have helped as we're building this and really growing it, which is very important. Also, be able to identify if and how you can help support. I believe everybody can help support when it comes to dissemination. That's part of our awesome part of being in the disability community, is that we are very connected with each other, and we do share information. And so helping us, that's the key that we really want you to walk away with here too, is how to get the message out. And then also understand how to become a partner with this very important work. So that's really what we want to make sure that we cover with you today. And we also wanted to give a big shout out, and we can move to the next slide, to our CDC Foundation partners. So thankful for this collaboration. This whole initiative really is made possible through funding from the CDC Foundation and utilizing those funds from donors to the COVID-19 Emergency Response Fund. Dollars at work, definitely. And we want to make sure that everybody's aware of that awesome collaboration. So we'll move to the next slide. Liz? And Liz, I think you're muted.
Of course I am. Thank you, Carolyn. We have a wonderful quote here from Judy Monroe, who's the president and CEO of the CDC Foundation, but just to really share the impact of the project overall. So I'll read this out to y'all. And there's a link here at the bottom that actually goes back to an article that was written about the project. We encourage y'all to click on that and check it out when you've got some time. But Judy Monroe says, like so many groups, the COVID-19 pandemic is creating dangers and hardships on people living with disabilities. But to help address some of the challenges being faced by people in this community, we are pleased to support the work of the team at CIDI and their partners working to create accessible emergency materials. Importantly, we believe this project can inform serving this community during future public health threats as well. So a lot of great work happening here within this project. And just like Dr. Monroe said, just looking forward to it working for folks just later on and making sure that we have full accessible messaging for those that need it most.
I love that quote, and you're exactly right. We appreciate Dr. Monroe and all of our partners jumping in and moving this whole project forward. As I said, we are from Georgia Tech, the Center for Inclusive Design and Innovation. I know a lot of you are familiar with us and have collaborated with us, and I'm so glad to see so many folks that are new to the conversation. We're excited about seeing the work that we have been doing with a lot of you for years being actually amplified and utilized in this public health space. As you know, at the Center for Inclusive Design and Innovation, what we're focused on is accessibility and inclusion. And so accessibility made smart is one of our slogans, if you will. And that includes ICT, information communication accessibility, accessibility consulting, making sure that we are going from that standpoint of nothing about us without us. So UX, user experience, focused on accessibility testing, a lot of focus groups, just like we've applied within this important project. Our Braille services are primarily focused on science, technology, engineering, math, And of course, the services that we offer when it comes to serving folks who are deaf and have hearing related disabilities within captioning and described media. We also have an amazing e-text production team that produces multiple formats. Once again, making sure that folks can get access to the information in the time that they need. So often working on born accessible concepts. And then of course, our assistive technology team, Tools for Life, which is celebrating 30 years this year. So very exciting. I'm also excited about our partners that are specific to this project. Thrilled to have the University of North Carolina Chapel Hill folks on with us from the Center for Literacy and Disability Studies within the School of Medicine. That's led by Dr. Karen Erickson, who's applying a lot of her body of research to our methodologies here, along with Dr. Lori Geist. And they're really looking from a research, but also that whole synergy of research, practice, and then education, and then into policy, hopefully, right? Research, practice, that whole synergistic piece. Of course, excited to have our partners, folks that we have quoted for years, and we're thrilled that we're actually in partnership with officially. From the American Association on Health and Disability, AAHD, as many of us know them. Having Roberta and Carlin and also Charles Drum with us, contributing their knowledge and experience, especially when it comes to knowledge translation and just making sure that we can get the word out. And so thank you all so much. And then of course, DeafLink, as we referred to earlier, and very, very happy to have them as a part of this project and really amplifying the message, but also helping support and user testing and script development and all of those very important pieces when it comes to producing high quality ASL. So Liz?
So we've got a little agenda just to let you know where we're headed in our next few minutes together. So we're going to dive a little bit deeper when it comes to understanding who needs accessible resources, talk to you about what we're providing, share information about how we're going to reach our target audiences. And then the most important piece is just sharing information and details about how you all can help us. And as I mentioned before, we'll have that whole Q&A as well, but feel free to type in questions or comments in the chat throughout if you're thinking about them.
So our audiences, who needs these resources? So our specific target audiences, it's working with folks who are blind and have low vision, who utilize Braille, and there's obviously a big need to have this type of information, this public health information in Braille. Also folks who are deaf and have hearing-related disabilities that use American Sign Language, ASL videos, individuals with extreme low literacy skills, and then individuals with mobility issues that could limit their access to information. And then of course, family, caregivers, that whole circle of support, others who provide services. So that's who we are targeting, and that's where we need your help in reaching out within your community, within whether it's your university, within your community, within your state, within your region, what have you. I love this slide. It's so beautiful. And so I'm definitely going to let you cover this one.
I love this too. Shout out to Trish Redmond, who is part of our team here at CIDI and specifically working on this project. She found some of these photos and it actually just turned into really a beautiful image. So I'll describe it here for you, but there's just 4 circles here and they're images of individuals utilizing Braille and communicating. So the very first one is of a little girl and she is just moving her fingers across the pages of a book that's in Braille. The second photo is Helen Keller doing the same thing. Then the third photo, you've got another little one using her iPad and a Braille refresh display. And then the last photo, Trish and I were talking about this and thought this was very profound, but it's Helen Keller with Charlie Chaplin. And we were just talking about what conversation could be happening in that photo. But, even with Charlie Chaplin and his movies and the way that he entertained. It was all about body movement, and relaying that language and just being very accessible as well too. So we just love these photos and just the way that folks have been communicating how it's transitioned over the years, and just wanted to share that with all of you. And that just really speaks to overall the impact of the project and how much more awesomeness and work we've got yet to do, but we're making headway here.
We have an amazing team, and so truly Premier Braille production team that is nationally known, internationally known for their work. We do quite a bit of work, really certified by the Library of Congress, making sure that accuracy, right, that's key, high quality, timely, all of those things, focusing on all of those. Our team is made up of folks that are on site who are actually producing, and then also folks who have been certified, multiple certifications within this team. We are absolutely a very proud member of and supporter and collaborator of our Braille Authority of North America. Guy Tolles, who is on our team, the manager of this unit, actually serves on that board. And then also it's initiated and continues to partner with correctional institutions, really teaching specialized and in-demand skill of literary Braille transcription to offenders, so that they can go out and get work, go back into the workforce. This is something that we've actually called Second Chance through one of our Second Chance grants. And it's another one of those awesome positive aspects that I think sometimes is on the periphery of the work, but actually, as we see it, it's front and center. So the next piece here, when it comes to improved access for folks who are blind and have low vision that utilize Braille through refreshable Braille displays, a lot of folks are able to access that information, digital documents, so making sure that all of the documents have that kind of access and accessibility, everything being Braille ready is key here, so that folks can go to the site, and be able to get that information in real time. And then also a very focused and very purposeful distribution of embossed Braille products, materials that are related to COVID. So making sure that folks can access that either if they want it through the refreshable Braille, but absolutely having that printed out. We've heard that folks absolutely want that, and we're listening. So we'll move to the next slide. Liz?
So when it comes to alternative formats for users, Braille is going to be in a variety of formats that the users prefer. So we're working on web page conversion to PDF and Word documents, as Carolyn mentioned, Braille ready files for users of refreshable Braille displays, and then of course embossed Braille request, which we're going to have that set up on our website for folks to be able to access. And again, this is where we need y'all to be thinking about where you could fit in to help us disseminate this information.
All right, another very cool part of this project that I think is definitely an area that a lot of folks need to spend a bunch more time in. And it's looking at how do we simplify text? There's misunderstandings that can happen if we don't have text at a level that folks can actually understand it and do something with it. So when we're talking about simplifying this, we're building upon the work that, as I said, Dr. Erickson and Dr. Geist have done at the University of North Carolina. What we're looking at is a lot of different guidelines, and how do we actually pull those things together in a way that makes sense, so that we can minimize the text complexity, so that our individuals who have various reading levels, that we can meet them where they're at, and have actually material that they can action, produce an action, whether it's understanding how you wear a mask, understanding a lot of things about going out into the environment. This has been a challenge for sure, no doubt. So why we need this guidance and minimize text complexity as we see it is the numbers are compelling. There's over 56 million adults in the US and the United States that have basic or below basic reading skills. So when we're talking about what below basic is, it's reading only simple words and phrases that are in a familiar context. And those pieces are very important to understand. The other piece here is reading comprehension, which is, something we need to pay attention to, that is consistently at the academic area with the lowest outcomes of adults with disabilities. We see that. We have a lot of our colleagues and friends who have been in this, that are in this community, and they understand. And so helping with reading comprehension is incredibly important. This is most pronounced among individuals that have developmental disabilities, intellectual disabilities. And so just making sure that we can help reach that community. Um, a lot of people have defaulted to plain language. I was at the United Nations doing a talk last year on this day, actually, in Geneva. And part of my talk was about what we are calling minimized text complexity. They were talking a lot about plain language. A lot of people talk about that. The first rule of plain language is really to write for the audience. And I think that's important, right? So the target audience needs materials that are significantly easier to comprehend than the average plain language documents. You can write plain language documents that are still at a college level. And a lot of people don't understand that. I think that they think it goes hand in hand with plain language means third grade reading level or simplified. And that's simply not true. The reading skills of students with intellectual disabilities often are at that below third grade level. And as they go through school, but by the end of middle school, we see that. Among all students with significant cognitive disabilities, only 9%, right? We're talking 9% read at the third grade level or higher. Among students with significant cognitive disabilities at the high school level, 19% can read words at a third grade level or higher, but not with comprehension. And keep in mind, what we want is that folks can get the COVID-19 materials and then they can act on it. So only 20% can read with comprehension at any level. So once again, how do we get this information into the hands in a way that makes sense? So developing the guidelines, right, for minimized text complexity. Our goal was big and ambitious, and I'm happy to say that we're actually meeting this goal. So to meet the needs of the entire population of adults with very low literacy skills, especially individuals with intellectual and developmental disabilities. Our process, when we're talking about that, is conducting we did conduct a scoping review of all the research that's out there. It was well over 1,700 different articles, and narrowing that down and coming up with guidelines and all of that. The product is indeed these guidelines regarding text, so word level, sentence level, document level, looking at punctuation that sometimes can throw folks, layout, there's a lot there to think about when it comes to layout, and the use of graphics and images. There's a lot of information around that, and it's important to pay attention to what research is telling us, and then also move all of that forward. And then of course to application, that's where it's at, right? So the development of COVID-19 guidance documents by applying the guidelines using a tool that actually was created through this project with the University of North Carolina and Dr. Erickson, Dr. Geis, by the research team to facilitate the application of the guidelines. That's an exciting development, one of many that's happened in this project. And so very, very happy about this. Once again, where we need your help, getting the information out. So overview of the findings. We believe in nothing about us without us. So reaching out, getting that information back, message testing, all of the products. And what we found is the majority of participants within those focus groups that participated in the message testing found that the minimized text complexity documents were indeed easy to read. The majority of the participants demonstrated ability to comprehend the documents. That's a big win, especially as we're asking people, to stay safe and understand what washing your hands is, all of that stuff. The complexity of COVID-19 topic areas presents challenging, an area of, it can be very challenging vocabulary for participants. And also participants, they like to have pictures, but comprehension does not seem to improve unless there's clear detail alignment with the content. So yes, it's great to have pictures, but not necessarily if they don't align directly with what's being conveyed in the text. And we'll move to the next. So here's the really cool information when it comes to the minimized text complexity products for COVID-19 guidance. The guidelines for minimized text complexity have been applied to specific selections, specific materials of CDC guidance, their documents. The resulting documents were submitted to the CDC for review and approval, and the resulting documents will be made available through this project, through our microsite that is going to be hosted at Georgia Tech and within the CIDI website. And we're very excited about that. So not just doing the work, but actually getting it out there. That's where the big wins are. So we'll move to the next. So as many of you know, this is the 10th anniversary of the CVA, which is very CVAA, which is very important legislation. And so I'm thrilled to see that we were able to work together and collaborate on improving American Sign Language scripts for video guidance with this project. That's a big win. And so American Sign Language, it's a visual language, as many of you can see actively right here before us. And signs they don't necessarily translate into specific words with specific letters. The letters, for example, ASL, don't necessarily mean anything to some folks who communicate in ASL. ASL, the sign for interpret, we've got demonstrated, yes, in a picture, and then also demonstrated within this webinar. And then ASL for sign, that sign, yes, we have an image there and also being demonstrated. So once again, a very visual language. And we can move to the next slide. So when we're talking about the audience, it's significant number of folks, of Americans who use ASL. And we want to make sure, just like within our Braille community, Braille users, that we're speaking to folks who could benefit from this with ASL. So 11.5 million Americans, 3.6% of the population, that's a big number, report that they are deaf and have some serious difficulty with hearing. Between 500,000 and 2 million folks who are deaf, they rely on American Sign Language for communication. And I pay a lot of attention to statistics, and we'll see that it's even sometimes ranked as the 4th or 5th most used language in the United States. A more precise number is not available because of deaf cultural identification. Census is not always accessible, that, a lot of us just have gone through the census. ASL is also not included as a household language option within the census. So that's why some of the numbers are not always easy to grab. Written English literacy, and I think this is important to be mindful of high school graduates who are deaf, only 7% read English at or above the 7th grade level. What we find is that actually reading levels plateau at the 4th grade level. And those are very important factors when we're talking about creating materials and creating meaningful guidance and in formats that would really reach the deaf community and our community of folks who use ASL. Liz?
So as Carolyn mentioned, we've been doing user testing, getting information, nothing about us without us. We want to include the community and to understand what it is that we really need to put out there. What is it that folks need? So we've gotten some feedback from ASL users and a lot of great things coming out from talking to folks within the community. Users identified strategies for making video guidance more accessible or identifiable. So some of the examples are making videos easily identifiable, like using the sign for interpret or a thumbnail of an interpreter as opposed to ASL as a written identifier. So example, having that video up on the website, making sure that that's clean and that's something that folks that need the video can absolutely recognize. And CDC responded immediately to that recommendation, and we really appreciate that. Using skilled interpreters who are fluent in native ASL, no finger spelling, facial expressions need to be visible. So Chris up there in the corner is doing a wonderful job, one of the best that I've seen. Using her face to, again, just communicate and relay that language as well. A message about COVID-19 guidance through channels that folks that utilize ASL use frequently. So finding out where do we need to meet folks in the community that need these messages, making sure that we're going there and that they're not necessarily having to come to us. Captioning is good and often helpful to others. And that's something that we've absolutely learned that it can be beneficial to folks that need it. But then again, it helps so many others outside.
So, one of the great approaches that we have been working on with multiple partners and making sure that we can get the best scripts so that we can then help produce the best videos out there when it comes to COVID-19 and really support the awesome individuals who are producing these videos and utilizing the guidance is looking at very specific language and the way that language is conveyed. So more effective ASL video scripts. What the CIDI team uses is we use the CDC guidance, Centers for Disease Control and Prevention guidance for the COVID-19 information to create ASL scripts and English scripts so that it can be used for captioning. A certified deaf interpreter creates the ASL gloss script for native signs, and that's very important for use by the video interpreter. These signs, obviously it's important to get as close to accurate and get it right on as much as we can. So the video interpreter then has that opportunity to review and possibly modify a gloss instead of interpreting from English script. So once again, making sure that the ASL, this graphic, this very visual, beautiful language is as close to possible and making sure that all of it is as accurate as possible. And the two-step video script development process improves both the signed communication and the captioning. So there's multiple wins through this process. There's an image over here of the interpreter that a lot of folks around the country have seen. She's been doing quite a bit with the CDC in those videos, Sarah. There's a link there where you can actually get to what's some of those videos. So it really is, ASL is ever changing. It's a dynamic language. And for example, the sign for COVID, there have been multiple signs out there for COVID and making sure that as this language evolves and continues to evolve, that we're able to communicate as effectively as possible to everyone. So we'll move to the next slide. Another,
Right. Oh.
Yes, you go. This is a great part of the project. Please, Liz.
Well, I was just going to say, coming soon, and we are very excited about this. And again, as Carolyn said, another great aspect of the project that we can get the information out to folks in the community and to all of you. So we've got webinars, we've got videos, we've got podcasts, all coming your way. The first webinar is actually this Thursday, November 12th at 2 o'clock. We're trying to keep the time the same and consistent for folks, but this Thursday is all about apps for promoting independence and safety. And y'all are going to hear from Carolyn, Danny Housley, and Sierra Montez on the Tools for Life team sharing more information about that. Coming up later in November, shortly after, we've got COVID-19 sanitizing durable medical equipment and taking a look at what that looks like for personal equipment for individuals. And Carolyn and I will be the ones sharing that information with all of y'all. In early December, we've got face masks and people with disabilities. So just talking about what that looks like for folks with disabilities, different types of masks that are available out there, different ways to put them on, and just some of the challenges and positives that folks are facing when it comes to having to wear masks now. Mid-December, we're looking at mental health and resilience within the disability community during COVID-19. And then as we jump into the new year, in February, we're going to have COVID-19's impact on individuals with disabilities and their loved ones. And then in February again, guidance for business and employers during COVID-19. And what does that look like, especially considering the needs of people with disabilities in the community. And as I mentioned, we have videos and podcasts. One of the videos that we're working on is a vocabulary of ASL signs. So that's something that we're actually very excited about. Carolyn just shared all sorts of wonderful information about ASL. What does that mean for this project, but overall for COVID and for folks with disabilities. So we thought even just having a collective area for those signs as they are changing and growing would be a helpful piece of a resource for folks out there.
It is very exciting. I love that, and so much enthusiasm around that.
So we are excited to let y'all know, and we've been talking about it throughout this presentation, that we have a microsite built, and it's hosted by Georgia Tech, and it's off of the CIDI website, and we're going to actually do a live run through of it here in just a few seconds. But again, just a hub for these accessible resources about COVID-19. We just wanted to create a one-stop shop that would make it really easy for folks to be able to access this information and to request more information, specifically some of those Braille resources that can be mailed to you. So I'm going to share my screen to give a live demo of the website, which we are very excited about. All right, hopefully this is visible for y'all. And
Great, yes.
all right, here we go. So as you can see, we've got the header up here that just shows that it's based off of the CIDI website. And so as you come here to the microsite, and we'll be sharing this URL and ways that you can access this website as we're reaching out to all of you as potential dissemination partners. You'll see this beautiful header here, keeping it very simple, COVID-19 accessible resources. Just an introduction statement here. What it does do is give you a link back to CDC's full guidance. And so here's a link here that you'll be able to click to go straight back to the CDC website to see the full original guidance. So again, we just wanted to keep it simple, straightforward, and so that way folks can get to the information that they need. So right here, one of the first things that you'll see is resources by accessibility. All resources and documents made available how you need them. So here we've got Braille resources. If you click, you'll be able to request Braille documents, and then you can view accessible documents, and you'll see more information there. We'll go back. ASL resources. As you can see here, we've got thumbnails of the videos as well. And then again, don't forget, folks can always go back to CDC's website to see full guidance. We've got COVID-19 simplified text. So more information will be coming here as we're populating some of those accessible files. And then of course, this last link here, accessible Word documents and PDFs as well. So all of the ways that we're translating this information, making it accessible right here at the very top of the website. As you scroll down and drill just a little bit deeper, you'll see additional resources. So we've got updated related articles and updates. You can see here, this is the article that we mentioned that came out about the project. We encourage you all to read that and share it. More information about webinars and training. So just this webinar is up here. Some of the others that we shared just a moment ago, they're all here as well. That'll give you more information about the webinar registration. Wanted to also just plug that we are offering continuing education credits, CEUs, and CRCs for all of our webinars moving forward. More information about CIDI and the CDC Foundation here. And then, of course, this page, which we're very excited about, our partners page. So currently, we have our partners that are involved in the project with development of materials. But we would love to have your logo, your website, and your information up on this website. So just a way that we can share more information about your program, your organization, as you're helping us share more information about this important project as well. And that's the quick run through of the website. So very excited about all the information that's going to be made available to folks. So we need y'all. We welcome your help in reaching our target audiences. Our dissemination plan is a list of partners and organizations serving all of these target audiences that Carolyn and I have been talking to you about this little bit of time with all of you. We're capitalizing on existing channels to reach those that need all of these materials. So as we said, we've got the microsite built, materials and resources will be up there. The other thing that we're doing is we're crafting messages, templates for social media, for email, for newsletters. And we want to make this easy for you. And those are all things that we can give all of you. Just again, that you can post and be ready to go. So we know that y'all can reach the folks that need this information. That is why you've been targeted. That is why you've been invited to this webinar, and we know the important work and the far-reaching grasp that you all have in the community. So as an organization serving folks with disabilities, you all already have those channels in place to help share information about COVID-19, the guidance from CDC. Any of your channels, social media, it can include Twitter, Facebook, Instagram, email, newsletters, listservs. Let us know. And as I said, we're working on those templates. We're crafting those messages. We just want to keep it as simple and as easy as possible for all of you to share all of this information. And we don't want this to take a lot of time and a lot of effort on your part. So join the project as a partner. As we said, we'll include your logo, information about your program, and a hyperlink to your website on the microsite. And of course, you can promote the partnership on your website within your organization through all sorts of social media channels. We have a survey that we're going to be sharing with all of you, and then we'll also be following up with an additional survey just to kind of gauge your interest and if you are interested in helping us disseminate these materials, which we certainly hope that you are. So we would like to know what questions you have for us about dissemination, about any aspect of the project. Feel free to type it in the chat, or if you'd like, you can unmute your microphone and we'd be happy to talk to you. And do we have any questions and comments in the chat?
Hey, this is Sam. I'm going to read some of the questions. 1 second. So we have a question from Debbie asking, how do you become a partner?
That's an excellent question, Debbie. Thank you so much for asking that very important question. I'm going to be moving the slide over to a survey link. We're also going to get one of our co-hosts to put this link in the chat so y'all can easily click on it. Debbie, if you or anyone else on this webinar is interested in being a partner to help us disseminate these materials, resources, and messages, click on this link. Let us know how we did with the webinar, but this will also tell us that you're interested. You'll have an opportunity to check off a box. You'll alert us, and then we're going to reach out to you in the upcoming days with all the information that you need to move forward. We've got documents created that you can go ahead and send emails out, summary documents explaining the project, what it means to be a dissemination partner. All of those are ready to go.
And it looks like we have some other questions too. Sam?
Yes, we have another, it looks like a comment. It's from Yenter. It says, add the comment, it would be the best benefits for Down syndrome too.
We definitely hear you, and thank you for that comment. I think also that's important to think about are all the different audience that could really benefit. So any of that feedback we are open to. I think it's also very important that folks understand, and I'm so glad that we and I had a couple of people actually just text me saying how much they appreciated seeing the details of how we got to producing these documents and these formats based on the excellent guidance. We are so thankful for the CDC and their guidance. And so, yes, we hear you, and that makes sense. So thank you for that recommendation. And also feel free to help spread the word about how we got to these documents and to this very focused assistance of getting these materials in accessible formats. So Liz, anything else you want to add? Or any other questions, Sam?
We have another question from Katrina asking if we'll be able to add the link to the website here.
Thank you, Sam, and thank you, Katrina. Katrina, if you fill out the survey and let us know that you're interested, we'll send you all of the materials, and we'll also include the URL for the microsite as well. We just wanted to be transparent and let folks know that the microsite is 99.999% there. It's not 100% populated. We're actively getting those materials in the website, and we just want to make sure that we've got it all there before pushing it out. But once you fill out the survey and let us know, we'll send you all the materials with the URL for the microsite as well.
All right, and we have just a comment from Caitlin who said, thank you all, this was great. Thank you, Caitlin, for being here. Tori posted on the CIDI Georgia Tech account the survey, so that is in the chat as well. If you missed it, maybe put it again at the end, Tori, because there's a bunch of questions and comments underneath here. So another question from Aaron. Many of the participants may be a part of the network of libraries through the National Library Service. Is the individual library considered a partner?
Yes, anybody who wants to be a partner is a partner. Excellent question, Aaron. And thank you so much for bringing that up. We've actively been working with National Library Systems. We've actually got Pat Herndon, who is on the webinar today. Pat is a longtime fruitful partner of CIDI and Tools for Life. And Pat is with GLASS here in Georgia. And GLASS is the Georgia Libraries for Accessible Statewide Services. And so we've been working with Pat on kind of our initial impacts here with outreach for this particular project, but absolutely, we certainly know that the libraries are so important in our communities, especially for individuals with disabilities, especially for folks that are still utilizing talking book services. And after talking to Pat, we've realized that folks are going to the libraries to learn more about COVID and about how to stay healthy and just to get resources and information. So absolutely, we want the libraries involved. If you're on the line and you are part of a library system, please reach out to us and let us know if you are interested. That is our next move to move forward with libraries as well.
And I just want to give a shout out to all of the libraries. I am a long-term user of GLASS. Pat Herndon, thank you so much for your leadership. And then also the whole network. There are so many of us that benefit, and we absolutely would love to have the individual libraries as a partner and the networks and, state, regional, what have you. Right on. Thank you.
Okay, we do have a question from Pat here. I'll jump to hers really quickly. Can we share the survey link with agencies that did not participate?
Yes, we will have the archive of this up and ready to grab, Pat. So we'll send that to you, and if anyone else that needs it, but please absolutely send the survey link out. This is our way to get folks to let us know if they're interested in becoming a dissemination partner.
Right, we have a question from Laura Kerwan that says, would you please list in the chat your current partners?
Yes, we can do that. If I can get one of the co-hosts to maybe type in our project partners, we could do that. Feel free to type in GLASS, National Library Systems, and then Laura, we're happy to connect with you offline outside of the webinar if you want any more information about other partners that have been identified as well too. And again, just exciting that we'll be building out that partners page on the microsite so folks can see who's committed to being a partner and disseminating these materials with us.
Yes, and obviously, so thankful as we said for AAHD and the University of North Carolina Literacy and Disabilities Studies group, amazing, that center, and then of course DeafLink. Yeah, there's just so much that we can do together. It really is about us working together, and I appreciate everybody being on with us. I'm seeing so much positive feedback too, and we appreciate that. So please let us know if you have questions, obviously, and other ideas that you have, and ways that we can reach out. Because this is invaluable information. So appreciate once again the CDC Foundation and their leadership in this space, and recognizing the importance, and obviously all of you as we leverage the connections in order to reach the individuals and really make this kind of significant change. And information is power, and we want to make sure that everybody has that power, that information when it comes to COVID-19 especially. What other questions do you have for us?
I'm going to combine a few questions here. People would like access or know how they can get access to the recording and then also to the PowerPoint.
Perfect. Thank you so much, Sam. So as we mentioned, we will have the recording, we'll have the accessible PowerPoint posted. We can actually put that on the microsite, I believe. But again, if folks fill out that survey, we'll have your contact information. Obviously, we've got a list of folks that we shared the invitation with, and we'll just go ahead and push that out so folks can have it easily available to them. But we will be posting archives, I believe, on the microsite under the webinars and resources page that folks can go back and listen to and look at.
Very good. Any other questions? I do want to give a big shout out to all of our teammates here, our Center for Inclusive Design and Innovation team, CIDI team. We have several, well, a few folks on with us who have helped produce this high quality information in the formats that folks need. And so really appreciate that and their attention to high quality and getting the information out.
Any additional questions?
I think I covered all the questions. We just had one come in that asked, will you be sending information to partners about the distribution of embossed Braille when it's available?
Oh, absolutely, we will. Any aspect of anything that we talked about today, we promise that you guys will have all of the information. So absolutely, we will do that. We are just as excited, probably, if not more than all of you, to be sharing this information and to get y'all signed up to help us spread the word. And Caroline, I think you said it perfectly. Information is power, and that's the best thing that we can do to for the folks that we serve in our communities.
Absolutely.
And I think I covered all the questions. If there's anything I missed, please let us know, or any other last minute questions, we'll be happy to answer.
Thank you, Sam. As we started out, I said time's the most valuable thing that we've got. We so appreciate you, spending this time with us, being thoughtful, going through this with us, and really focusing and carving out this time to be with us today. We do want to stay in touch. Obviously, we will stay in close touch with you. And it looks like there might be another question.
Yes, asking where people can send questions to later.
That sounds great. If somebody wants to type in my email address, I am happy to be the one to answer any questions that y'all have. So please feel free to reach out to me.
And Liz's email address, do you mind just reading that for Kathy and our participants?
Absolutely. So my email address is liz.persad, PERSAUD at gatfl.gatech.edu. And thank you, Sam. We've got the proper email address up there. So liz.persad@gatfl.gatech.edu. And please feel free to reach out to me anytime for any questions that y'all have about this webinar, about dissemination, about any aspect of the project.
Excellent. Okay. Well, thank you very much, everyone. Really appreciate you spending time with us. We look forward to working with you as we collectively navigate this and, time of COVID, and especially get this information out. And so thank you for listening to us and taking up the charge to make that happen. Thank you very much to Liz for pulling together with your team, Trish and Sam, and everyone, the dissemination plan, and making sure that we can actually, get all of this information out. Thank you to Kathy for doing such a great job as our interpreter today. Thank you. And thank you, Heather. So appreciate you doing our captioning. And Tori, excellent job on pulling together the webinar with Sam. So thank you all very much. Liz, anything you want to say as we wrap up?
I think we've covered it all. Thank you all for your time. Please reach out if you have any questions, and we absolutely look forward to hearing from you and working with all of you. So appreciate you very much.
Y'all stay safe, be well, and take care of each other and take care of yourself. All right. Bye.
Bye. Thank you, everyone.
Thank you.